Hello, everyone, and welcome back to another exciting episode of Mom's Chit Chat.
Yeah.
So good to be back with my babes, so we can catch up and just talk about mom stuff as always. In case it's your first time of watching us, we're about to become your new favorite mom trio.
Yes.
My name is Ugwuibe. I'm the founder of TK Wellness.
And my name is Jane Ogoye. I'm the founder of Fab Mom NG.
My name is Motukwe Enyila, the founder of High Mom Soul.
Okay, awesome. So let's get into it. First of all, you might have noticed that we're all wearing pink. I'm wearing 2 shades of pink because Team Extra. And that's because we're going to be talking about breast cancer. As we all know, October is Breast Cancer Awareness Month. So we thought it was important and appropriate to discuss breast health as women. So before we get started, I wanted to read some important facts about breast cancer. And then let me know if you knew this, because there are things here I had no idea about. So 1, breast cancer is one of the leading causes of death for women in Nigeria.
Yeah.
You knew that?
Yes.
You knew?
Yes.
After cervical cancer, I know. Cervical cancer and breast cancer are like very...
I had no idea.
Yeah.
Wow. Some risk factors that are associated with the development of breast cancer include increased dietary fat, alcohol intake.
Alcohol. Wow.
Alcohol intake, family history of breast cancer.
We know
that. Delayed age at first full-term pregnancy or childbirth.
That one is a new one to me.
That really gives us a lot to think about.
Very scary.
Because people like me who want to have like 8 kids.
Okay, Nicole. Okay,
maybe not. But it just kind of gives you a lot to think about, right? And obviously we know that early detection is the key to treating breast cancer.
That's true.
Going back to your knowledge of breast cancer, how much would you say you know about the subject?
Up until recently, I'm not one to like take so much interest in it, because up until I began to see how the prevalence rate has got shot up. So I began to feel that it affects both the young. We used to think, how we used to think it's for old women.
Yes.
But now you see ladies of under 30. Some even haven't had kids. So, sometimes all these risk factors, things could be dicey. And I'm like, we really need to begin to pay attention to our breast health. So apart from for aesthetics, you need to, beyond your breast looking beautiful or pretty in clothes, you need to begin to take extra care about it. So what I know about is the, checking self-examination. I think after your periods. I think the doctor will shed more light on that.
I hope so.
Yeah,
do you know how to do a proper self-examination?
Yes, so I know you use your 2 fingers, and check for lumps. Just go round.
I know you have to raise your hand.
Yeah. But they always tell
you see the graphs of
going
in all the doctors' offices with your hand up.
Exactly. So they'll tell you check after your menses.
Right.
Because you get all bloated.
And then your breast tissue consistency changes.
Exactly.
Right? Because of the hormonal changes that happen with your period.
Well, for me, it actually dawned on me about 3 years ago when I lost a friend to breast cancer. She had a baby, and I think 3 months. Was it 3 months or 2 months?
Wow.
Then
how old was she?
How old is she?
31, 32.
31.
Yeah, it was really devastating. Really devastating.
Wow.
How did she find out that she had breast cancer?
So I think it was when she was pregnant.
Wow.
When she was pregnant. And I didn't even hear about her death until afterwards. After her death, then the husband just called. Something happened about a month ago, and at least for 6 months I wasn't myself.
Of course,
I wasn't
myself.
Wow. And since then, I have been very, very. I've been very, very conscious of my boobs. I've been very, very conscious to be sure that there's nothing going on. Any little, I'll just call my husband. Hops, I think.
Can you check? Yes, let me check for you.
So yes.
Okay, that's incredible.
It's a very sensitive topic.
I'm completely ignorant, and it's embarrassing at this stage. We are all aware that breast cancer is a pressing issue for women, right?
Yes,
but I've never really taken self-examination properly. In my mind, I'm like, I'm so young.
Oh no,
breast cancer is an issue for older people. That is their problem. That's not my problem. That's not the case. You saying the story now has completely shocked me because I'm 31. So that could easily be
Yes,
me, and I'm not
exactly.
Can be
checking.
anyone.
Exactly.
So I think that's why it's really important for us to have these conversations as moms, because you don't know what you'll be sharing that can actually impact someone
else.
and
we don't want
help.
to die young.
Nobody
God
wants
forbid.
to.
We don't want to leave our
Nobody
children
wants to.
behind.
I
So we need to
know.
begin to take, proper care of ourselves.
Absolutely.
Self-care is really important.
So on set with us today, we're so lucky to have Dr. Ugwuibe. Please talk to us, introduce yourself, and tell us more. We have so many questions about breast health, so talk to us.
Thank you for having me. My name is Dr. Ugwuibe. I'm a medical practitioner here in Lagos and also a founder of Concierge Medicine Nigeria, which is a health consultancy firm which stands as a bridge between doctors and patients. Yep. So nice to be here.
Nice to have you, because it's such a topic that needs a lot of talking about, and we have so many questions, and we know that this would be super informative, not just for us but for the viewers out there. So for us, it was very important that we actually got a proper doctor to inform us and enlighten us. So please, can you tell us more about breast health and why it is important to know about the general condition and well-being of your breasts?
Okay, so breast health, or your breast, is a very important part of the female body, particularly because of the aesthetics which the breast gives. So it's a very important part, and then that's why breast health is very important. Breast cancer, it's the leading cause of cancer death in women.
Wow.
Particularly in this part of the world. So that's also why breast health is important.
Right.
Every woman is supposed to know her breasts.
Right.
And know what it feels like. Because that is only when you can detect when there's an abnormality. Yes.
I found that from when I was younger, the consistency of my breasts have changed. So what am I looking for? So if I'm examining it, am I looking at softness or how high they are? Like what should I be looking for? Because, these are breasts that fed 3 kids and not quite the same as when I was 18. And so what is it that we're looking for when we are checking?
Okay, so when you're checking, and that's what's called a self-breast examination or breast self-examination, as you want to put it. When you're doing that, you're looking for any change in consistency first. So starting with if there's a lump in so first of all, you look and see if there's a difference in size, particularly between the left and right breast.
Okay.
So you start with looking, then you start to see if there's any change in the color of the nipple, skin, if there's a redness around it. So everything just has to do with just looking first before you start feeling, before you start touching. So you have to look first to see if there's a change in size, any nipple retraction. So maybe the nipple is like going inward. And then sometimes you can also see like discharge. The spontaneous discharge that you can see as well when you're just looking. So you do it just looking before you then do the proper self-breast examination. So for a self-breast examination, you're looking out particularly, especially when you're looking out in case of cancer, is to find if there's a lump. So the lump can feel hard, it can feel soft, it can just be firm. Soft. So it just depends. So a lump is not necessarily cancerous. So the consistency, is dependent. It will differ, most likely differ, even though not in all cases, but then the consistency may differ. So there are other benign breast conditions. When benign means they are not cancerous. So there are benign breast conditions. So you might have a cyst in the breast, for instance. So cysts feel like. So you see that kind of thing mostly in younger people. So you might have a cyst, you might have an adenoma, which is like say like fat tissues in the breast, which has come up to feel like a lump.
So basically, if you're doing an examination and you feel a lump, that's not automatically I have cancer and dying.
That's not.
Because some people, I panic if I did an examination, I found a lump. I'm like, it's so bad for me.
But then, should you panic when you feel any lump?
No, you should. You shouldn't. But I'm sure it's natural for anybody to want to panic or want to panic. But so when you feel any lump, then it's good that you go to see a doctor to have it examined and then do some other tests, which we'll talk about as we go on.
So if it's not after the test and the find out that it's not cancerous, can you just leave it there
No. It's advisable you take it out.
Wow.
So many times, even the test, before you do, you do a test which most likely will range from an ultrasound. So an ultrasound, just like we have ultrasound for the, so you do it as well. So you range from an ultrasound to a mammogram if it needs to be done. Yeah, so, and then most importantly, they have to do a biopsy. So a biopsy is, so they have to take out a sample from it. So that is actually the biopsy, before you go out to do any major surgery, it's a biopsy that will tell us whether it's benign or cancerous.
Right.
So, and then to stage, if it's cancerous, is to stage it to know if it's what taking out the whole breast, or whatever treatment options that there would be was determined by the biopsy. So, but when you see a breast, you don't have to panic, even though it's natural to panic.
Of course.
But you try not to panic. Just go and get the appropriate medical test. See a doctor, and then you will follow through from there.
I have a question for her, doctor. You talked about that one of the signs you should be looking out for is if a particular breast is bigger than the other. But I know growing up, we're told that our breasts aren't on the same size.
Yeah, you're right.
So are you saying that if it is considerably bigger?
Yeah, exactly. Okay. So if it's considerably bigger, because even though naturally one is bigger than the other, but you know that, okay, this is now unusually bigger than, So
that means, because right now there's a spike in the sale of breast enlargement pills, breast enlargement tablets, and some people exactly. And the crazy one I see right now is the pumping. They call it vacuum. So they say that instead of going on vacuum,
a vacuum,
like so instead of going under the knife, they sort of like suction, they suction it, and you see. So are these risk factors?
Well, to be honest, they are not.
Oh, okay.
Even like a breast augmentation is not necessarily a risk factor no, it's not necessarily a risk factor for breast cancer. Yeah. So we can talk about the things here. So the risk factors, let's just go on to the risk factors. So the risk factors for breast cancer, particularly, of course, being a woman, is a risk for breast cancer, even though men also have it, but then that's a very low percentage. So the risk factor is your age, your gender as a woman, then your age. So after 40, there's a higher risk of having breast cancer.
Okay, but would you say that, for someone like myself who's young, I'm practically a teenager, I'm 31. So I've always looked at breast cancer as something for older people. And then you read the statistics, like, 40s, 50s. So I feel like, I still have 10 years ahead of me before I even need to even check my breasts. When would you say is an appropriate time for women to start, cultivating that habit of regularly checking your breasts?
Okay. So any woman of reproductive age should start doing a self-breast examination, especially when you're not aware. So let's say from 18.
Wow, from 18?
Yes. Yeah. So any woman of reproductive age should start doing a self-breast examination. That is just, it's a constant. It's not something that should be like, so many people don't know this, but I mean, that's what it is. Ideally, any woman of reproductive age. And then, as much as is common, or the risk is higher in older women, it still happens in younger people. I have a patient who actually lost, it was one of my most painful cases of breast cancer, who actually lost, and she was in her late 30s. And it just happened like, I'm like, okay, what's going on here? So so it still happens in younger women. You still see occurrences.
So for your patient, right, who you lost quite quickly, what symptoms did she present? Was it just that, her breasts were hurting, or she felt a lump? Like, why was it? How did it happen so quickly? And what symptoms do we look out for to now know, this is really bad. I need to get to a hospital right now. Okay.
So just before I jump into my patient, I was talking about risk factors.
Right.
So another major risk factor I need to talk about is family history.
Okay.
That is like it's out there. It's hereditary. So there's a 4 times chances or increase in chances of a woman having breast cancer if her first degree relative has breast cancer. So if your mom has your mom or your sister.
Really
oh wow! 4 times.
So you have 4 times.
Yes.
So you have to check. That's a very that's one of the major risk factors. To be fair, family history of breast cancer. Even though, of course, this is happening in people who don't have family history anyway. But then that's something to note. The other risk factors, I think you talked about them already. The other risk factors like lifestyle, obesity, dietary, alcohol.
Please let's go to alcohol. Alcohol. That's what I'm interested in. Alcohol. I mean, so with the odd glass of wine here and there, every other day, like every day, just to cool the system down. Will that increase my? I'm not asking for a friend. It's not as if it's me. Oh, you're asking for me? I'm just a friend. So, will that increase my chances if I just had like a glass here and there, champagne with my small chops at a wedding? Would that increase my chances?
No.
Okay.
Just, I mean, as long as it's not like chronic alcoholism, that's where you have, a problem. But a glass of wine here and there, champagne here and there, I think it's fine.
Okay.
As is needed.
So I want to talk about a friend of mine. I mentioned it earlier, who lost her life to breast cancer after having a baby, 3 months postpartum.
Terrible.
And till date, I still find it very hard to believe that. I mean, it happened so fast. They found out when she was in her second trimester, and bim, everything just went from 0 to 100 in a few months. And I still find it very hard to believe. I mean, how did it happen so fast?
Okay, so for breast cancer that's usually detected in pregnancy, it's most likely there were abnormal cells already before she even got pregnant. I mean, so the molecular part of breast cancer is too technical to talk about here. But I mean, cancer like breast cancer, like every cancer, is just due to abnormal cells or molecular cells that are just they start going haywire. So most likely she had abnormal cells that are, But the thing with pregnancy is that because of the hormonal changes that come, so it will most likely just make it like, and then also because you're trying to spare the life of the baby, so the treatment options may be limited. It might not be as aggressive, and also depends on whatever stage it is that it was. So for many people, I mean, breast cancer in pregnancy, it's not. It just may just be aggressive just because of the hormonal changes that comes with pregnancy, and then because you're limited as well in terms of treatment. So like my patient I was saying who had breast cancer, she just came in that day with a lump. It was an early morning. I was on call overnight. And then she came in the morning. She was the first patient. I remember her very clearly because she was the first patient I saw for the day. She came in and she's like, she had a lump in her breast. And then she also said, I remember she said clearly her husband has also noticed the lump. So that is another way. So I was going to go there. You moms, that is another good way of breast examination because your partner, husband, knows what your breast feels like from. So many times they also they may be the first people to detect if there's what's this. So she also said, her husband had also noticed that, and then she wanted to just know what it was. So for her age, I was like, I'm sure this one is just a benign thing. I even she didn't take. She also said her siblings, 2 of her siblings, also had lumps that were removed, but were not cancerous. Okay. So in my mind, I'm like, okay, well, I'm sure you're going to be the 3rd sibling. Like nothing, because for her age, I didn't think there was anything going to be that serious. And then I referred her to, because eventually there's a surgeons that handle cases of breast cancer. And I asked her to go do like the appropriate tests. I did everything I was supposed to do and then referred her to the surgeon. And then she went to the surgeon. At that point, they did a biopsy and then that took a tissue. And then I guess they found out it was cancerous. Wow. She got treatment, or she started treatment, chemotherapy, particularly, I think. But we lost her mostly due to the complication of the chemotherapy. So not necessarily the illness, but I mean it happened within 3 months more.
So the chemo can actually be complicated.
Oh yes.
Chemo is very
it's a very different. So we lost her due to that. Yes.
That must have been so difficult.
It was really difficult because I also remember For some reason, I'm like, this one is following me, because when I was also the one on call when she was brought back in the crisis. Wow. So, I mean, it just went downhill from there, and then eventually.
I want to ask for the layman, so that means you can't come down with breast cancer overnight?
No, most likely not. But you will not know. Even if those cells are already going here, but you do not know.
Right.
So how frequently should we actually check our breasts?
So you should do a self-breast examination every month.
Every month.
So which is like you guys already talked about it. Yes. When you're doing after your period. Because those are the hormones are more settled at that time. Just a few days after your period, you should do a self-breast examination every month. And then when you're doing it, most people are just used to doing just around the breast. You should also go onto your armpits, the axilla. That's what they call medically, because there's a spread, there's a lymphatic spread. Yeah, so the lymph spread there. So that's another place. So you can actually have a breast cancer that's there. Wow. More that's technically, yeah.
Okay, so Doc, can you kind of talk us through how to do a proper self-examination? I know it's something about 2 fingers, 3 fingers, rubbing, but just give us an overview on how to do it, please.
Okay, so to do a self-breast examination, so you start with a physical examination, which is preferably looking into a mirror, and then looking at the physical, looking at the breast physically to see if there's one breast is bigger than the other, if there's a nipple retraction, change in skin color, and all of that. And then after that, still standing, you can then do the examination now, where the right hand examines the breast, left breast, the left hand examines the right breast. Preferably, of course, you should then raise your hand above your head,
above your head,
behind your head, and then you can imaginarily divide the breast into 4 parts, like across 4, and then in a circular motion, you can use all 4 of your, as long as it's just the flat part of here, and then in a circular motion, check, imagine the 4 parts, and then extend it. You must extend it into the axilla, all the way to the armpit, into the axilla, because it could spread that way as well. So that's, and then it's important to do that monthly, every month after your cycle, because at that point your hormones are stable enough, more or less. Then other important things to note is after the age of 40, you should get a yearly mammogram. After the age of 40, you should get a yearly mammogram. But if there are risk factors, so if you're like your mom, you've studied the family risk factors, so that may start earlier. You might have to start getting a yearly mammogram earlier. Then from age 50, 55, you then have to do it biannually, so about twice a year. Yeah, I know. So it's
if
very
you don't
important
know how to do a self-examination, right? What do you then do?
Okay, so you can just walk whenever you go. So you can walk into the hospital and ask anyone to teach you. And then, you'll be taught how to do a proper self-breast examination.
Okay, fantastic. And then if you maybe notice any abnormalities while you do the self-breast examination, then do you go to like a hospital or diagnostic center or something?
No, you should go to a hospital, because the doctor has also physically examined you before you start running. So you physically check you, to get a history, like just find out what the risk factors may be with you, and physically examine you, and then send you on to do further investigations and tests as the case may be. And then for treatment of breast cancer, mostly is surgical. Even though you have radiation and chemotherapy, so those are the main treatment options you have for breast cancer.
Okay. And then one last question. We've spoken quite a lot about the risk factors, and you mentioned family history, and then earlier you mentioned age, alcohol, which shocked me for my friend. That shocked me, and dietary fats and things like that. So those are the risk factors. But then what can we do in terms of our lifestyles to prevent it from even happening in the first place?
Okay, so there are some preventable ones and there are some non-preventable ones.
Right.
So the ones that are preventable, which is like lifestyle, a healthy lifestyle. So things like obesity, which is fats. You have to try and cut down on those fatty foods and all of that. Then cigarettes. please, you need to stop smoking.
Right.
I mean, because apart from breast cancer, there's so many other things that are linked with cigarette smoking, so that needs to stop.
Also, sorry, so cigarette smoking is linked to breast cancer, it's not just lung cancer?
No, yes, this is
Wow.
breast
Wow.
Wow.
Okay.
Yeah, so cigarette smoking needs to stop that. In fact, stop it. Then what other things with lifestyle?
Maybe like exercise?
Exercise, of course.
Food. How about food?
Exercise, food. Of course, you have to cut down on fatty foods.
I get sugar too. It's
not directly linked, but the thing is, I mean, sugar, like, it has to do with diabetes, but those other illnesses can also be linked to. Illnesses are always linked to one another somehow. So eventually, but not directly linked.
Okay.
And then another risk factor, which is also important, is exposing yourself to radiation.
Wow.
Okay.
Radiation, I didn't,
Radiation, like from your phones or from.
So radiation, one of the most is when you do like X-rays.
Okay.
So for people who do have maybe certain illnesses that they have to do X-rays very
regularly.
often, they have to start early to start checking for these abnormalities.
Oh, is that why people are really hesitant, or doctors are hesitant to do X-rays?
Yes, right, in women particularly because of that exposure. Yeah.
Okay, well, ladies, that was a deep and insightful conversation.
Yes, very, very.
I feel like I learned so much.
Same
It
here.
was amazing.
Same here.
And we're so grateful to you, Dr. Uju, for taking time out to come and talk to us and educate us on this very important topic.
Thank you for
Doctor.
coming.
Please, if you have any questions or concerns about breast cancer or your health in general, make sure you follow her at Concierge Medicine NG on Instagram and ask her any questions you may have. And make sure you follow us as well on Instagram at MomChitChat TV to keep up with all the new episodes and the hottest gist. And we're also on YouTube at MomChitChat TV. So yeah, until next time, guys. Thank you so much for watching.
Thank you. Bye.